This is a presentation on clavicle fractures and their treatment. The surgical indications for a clavicle fracture are a 100% displaced fracture greater than 2 centimeters of shortening, an unstable distal third fracture due to ligament disruption, an open fracture, which is a fracture where the bone has broken through the skin, a fracture where bone causes tenting of the skin, meaning you can feel the sharp edge of the bone right underneath the skin, a non-healing fracture that is symptomatic, a floating shoulder, meaning that there's a clavicle and scapula neck fracture, and also when there's a vascular injury. Non-surgical treatment involves immobilizing in a sling, gentle range of motion exercise after 2 to 4 weeks, active strengthening after 6 weeks. There's up to 5% non-healing rate with non-surgical treatment. There's up to 50% non-healing rate if it is a distal 1/3 fracture treated without surgery. What are the outcomes in conservative treatment without surgery when surgery is indicated? Higher rates of non-union, persistent deformity after healing, decreased shoulder strength, and decreased endurance. How about after surgical treatment? The outcomes are improved function, less pain with overhead activities, anatomic restoration, a low rate of malunion or non-union, increased shoulder strength and endurance. However, there is a risk of hardware irritation and prominence given that the clavicle and the hardware can be felt usually right underneath the incision. Here's an example of a malunion, non-union, that came to see me who had been treated non-operatively, and he had a very large lump on his shoulder and shortening of the clavicle and loss of full motion and strength. I performed an open reduction internal fixation where I lined the bones up, placed a plate with several screws, and you can see the end result. Here's a second example of a displaced midshaft clavicle fracture with a third fragment called the butterfly fragment. This met surgical indications, and therefore I fixed it with an interfragmentary lag screw through the butterfly fragment as well as a plate and screws. Thank you.